Hello, everyone. My name is Dr. Richard Horowitz, and I am co-host of the Healing from Lyme Summit. And it's my great pleasure to introduce to you Randy Breton. Randy has been a good friend and a compounding pharmacist that we have used at the Hudson Valley Healing Arts Center for, I don't know, Randy, it might be 20 or 30 years at this point. We've been together
Yeah,
for,
it's a long time.
it's a long,
It's
it's
a
a
long
long
time.
time.
Yeah,
Um,
it's been a great partnership, I guess is the best way to put that.
Yeah. So we're going to talk today about compounding solutions for chronic Lyme disease and co-infections. And I just want to give you a brief intro on Randy, and then Randy, you can take it away and tell people a little bit about yourself. But Mr. Breton has a rich background in all aspects of pharmacy consulting, practice, microbiology, nationwide logistics, pharmacy law and management, and his career has included many aspects of pharmacy practice, retail, hospitals, sterile compounding, non-sterile compounding, and an integral part of the design and construction for pharmacy and microbiology laboratories. So, Randy, it's great to have you here today with us, and thank you. Tell people a little bit about yourself and kind of how you started getting into Lyme and tick-borne disorders.
Well, thank you for the fabulous introduction. I really appreciate that. It's the great part about getting to be this old is having the experience to apply this kind of thing to help patients and other and practitioners do their thing. So we got into this 25, 30 years ago. We realized that there was a lot of patients out there that, because of the Lyme diagnosis, didn't have a lot of insurance. Okay, so and this was a big problem. They needed treatment, and what we did was we kind of got rid of there was no insurance to begin with, so we kind of went to a cash model. But what we did was we tried to make it affordable as much as we could to still keep the lights on, but still make it so that patients could get therapy. And that's been kind of our mantra from the beginning. And don't just take my word for it. Get out there and ask some people. We have a very good reputation within the Lyme community for this type of thing. I encourage you to call us if you have other issues or problems, because sometimes we know the answers, or sometimes we know people that do know the answers. So. Yeah,
No, and in fact, for people listening, Randy and I have known each other. I've been using InfuServe compounding in Florida now, as I said, for a couple of decades. And you're right, Randy. I mean, you guys are one of the least expensive, probably, compounders I know of. And a lot of times, and people should know this, when their insurance companies do not approve certain drugs, I won't go through all of them, but it could everything
no.
from nitazoxanide, Alinea, to whatever it is, and they give some ridiculous price, like, oh, it's $1,000, I'll go to you.
Right.
And it might be a tenth of the cost, right, of what it is, and people get what they need. So you've been actually indispensable in our practice to get people some of the products we need.
Yeah, no, thank you for that. That, like you said, it also applies to some of the commercial products. Okay, because if you go to get a cash price at a Walgreens or CVS or something like that, that cash price is often very high. Their algorithms are kind of built differently than ours. So now it doesn't always work out that way, but it's worth the phone call at least, because we do our best to help people out that don't have a lot of cash to do these type of things. We want people to get treatment. We want this to happen. Yeah.
And by the way, in the phone number, we'll get into this later, but 1-800-886-9222, is that the best one to get in touch with you?
That is our has been our 1-800 number for 20 years. So yes, by all means.
By the way, the fact that I've memorized it and know it by heart and don't even have to look just tells you how often we need to call your compounding pharmacy at InfuServe.
Absolutely. Yeah. The thing is that we have been doing it for quite some time. We're dedicated to it. The ethos around here is very Lyme centric. We do things that other compounding pharmacies don't do. We make a lot of phone calls because people have brain fog. They forget. They do other things. We remind them on for refills. We remind them that things are being shipped. And again, we understand the problem very well, and sometimes that helps. And we're in very close communication with our patients. It's not just calling in for a refill. We want to talk to you. We want to see how you're doing. We just want to know what's going on. We have a lot to add to that conversation because we've been doing it for quite some time.
No,
So
I mean, I know because again, we've worked with you guys for a long time. There really is a compassion and a caring, which I don't think most people get from pharmacists these days. I think you guys are a little bit you're a little bit like us. You're a little bit of the dinosaur in the age of where I'm a solo practitioner out there, helping people. You're kind of the same thing a little bit. You're in there
yeah,
in the trenches, getting people better, calling them, making sure you're following up, making sure they're
yeah,
getting what they need. I mean,
yeah.
it's a great service.
Yeah, I spend a lot of my time on the phone speaking with not only practitioners but patients, and a lot of sometimes those phone. I mean, you can ask some of the patients. Some of those phone calls go for 40, 50 minutes. It just depends on what I can do to help them, and part of that is just education too. Because there's a lack of education for certain things, and since we've been doing it for so long, I feel that we need to pass that information on because it's hard. It's hard out there to do this kind of thing.
Right.
It's difficult.
So Randy, why don't you tell people? I mean, there's a lot of things about compounding we need to discuss today. Like one of the things I
Right.
want to really go into with you is some of the most frequent questions you got about like, why should I consider compounding a medication? Now, for me, there are only
Mm,
certain medications you can get compounded, but what are the most
yeah.
frequent questions you get about compounding? And and we'll talk about this. I think we need to be, very transparent. There were issues with compounders a couple of years ago because of
Yep.
one
There
of the
were.
compounding pharmacies, not yours, that got into trouble because there was a fungal problem, right, in some of their IV
Yep.
solutions. That
Yep.
became a
That
really big problem for compounders. So tell
it
everybody
did.
like how you got around
Yeah.
these. What kind of questions do you get?
Well, speaking directly to the problem that happened at this point 7 or 8 years ago, that was NECC, and those were sterile compounds, and um, I know a fair amount about that particular situation because I was asked to consult for that particular incident, believe it or not. So the thing was is that there were a lot of breakdowns in that particular pharmacy relative to quality control. And what I can tell you is that our quality control is very robust, to use a word, at this juncture. We took what happened in that incident and we applied it to everything else that we do. The other thing that we applied was is that we do a fair number of actual drug studies, FDA sponsored kind of drug studies, and we've taken even some of that experience and applied it to some of the logistics and shipping that we do relative to keeping the temperatures of drugs consistent when they're shipped because
Mhm.
we're licensed in all 50 states, so we ship everywhere, and that's an important concept. Some compounding pharmacies don't have that much of a reach, so it's not as much of a concern for them.
Right.
But
No, no, all,
yeah,
all
we
50
took.
states is important. And for me,
Yeah.
I think one of the first things I started using you guys 4 years ago at InfuServe was when we were doing glutathione, right? I was getting my
Yes.
IV glutathione, right? You were one of the first sources.
Yes.
And
Yes.
it's so
We were.
important to know about the safety because if you're preparing glutathione, both for my office, right, or for people that might be doing it at home during DAP you've got to be sure that there's no impurities, that it is pure, that the exact amount
Yep.
is what it is, right?
Yeah, yeah. A lot of that comes to fruition at the end where it gets shipped to you guys, but there's a lot that goes on before that occurs, obviously. And some of that has to do with where you're getting the raw materials from, which is really important. Um, as a sidebar, that's going to be important when we talk about methylene blue, which we should talk about in a moment here. The other parts of this are the fact that early on we made a lot of we did a lot of things that other pharmacies didn't do. We actually created a microbiologic lab downstairs. It's a separate entity. It's called Pharmetric Laboratories. And what this enabled us to do was to test everything that was a sterile product practically instantaneously. Back in the day, there were a whole bunch of different things that you had to do for compendial testing, where things came as plates that you put things on to see if things would grow. We were the first ones to pioneer phospholuminescent technology, and this laboratory does this now. And what it does is instead of being able to get an answer in 14 or 18 days, it gives us an answer within 4 days. So that helps us, manage how the batches of sterile products are done. And again, it speaks to our quality control. We were the first adopters of that kind of thing.
Right.
So it really, that's part of what should be important for you to ask someone, oral compounding pharmacy, hey, uh, what do you do to ensure that my product is sterile? Those are questions you should ask other pharmacies if you're considering a compounding pharmacy for things like this.
Right.
Yeah.
No, it's
So,
a good point. And since you brought it up, so let's talk about some of the major products that we order from you all
oh
the time.
sure,
The
oh
the
sure,
list,
Yeah.
we'll talk about maybe the top 5 or 6, like
yeah,
LDN, low dose naltrexone,
yep,
the peppermint oil, the methylene blue, of course, that we get from you that I could
yep.
not be able to do dapsone, right? Otherwise, really without it.
Otherwise,
But
yep,
otherwise, we get compounded pain creams, right? Hormone
correct,
preparations,
yep,
ketotifen for mast cell, and I know
yep,
some of my chemically sensitive patients, you're compounding their medications like the dapsone, the doxy, rifampin, zithro, whatever. They can't even take regular drugs. They have to get it compounded with carrot flour or coconut
yep,
flour. So let's go down one by one and talk a little bit about these products because these are essential
sure.
for me in my Lyme practice. Um,
Of course, of course.
when do we start with methylene blue since you brought it up and it's one of the most important ones we use?
Yeah, methylene blue it was a really interesting one. I mean, everyone needs to know that I received a call from Doc here about 7 or 8 years ago, and it was about the dapsone protocol, right? And the fact that we needed methylene blue to basically handle a side effect of another drug. And methylene blue is kind of old. Okay, it was first started used back in the 1920s to treat malaria. And because it was so old, there wasn't a whole lot of information on it. So I had to do a lot of kind of scholarship to figure everything out. And that's where all this dosing came from. Now, as far as a compounding pharmacy, the important part about methylene blue is that methylene blue can be used in other things and often is. I mean, it's used to clean fish tanks. Okay, it's used in water treatment. It's used in analytical chemistry and things like that. Now, the important thing to remember is that you can go online and you get methylene blue just about anywhere, but it's not for human use. Okay, a lot that speaks back to the fact that compounding pharmacies under law have to be very cognizant of where their raw materials come from, and that sometimes increases the price because the stuff that you get online is inexpensive for a reason. Not the least of which is that the raw material may not be methylene blue. It could be indigo something or other. Okay. It also it enables you to understand the raw materials we get. It comes with a certificate of analysis where you can understand what the impurities are, what they aren't, how much is in there, how much isn't. And again, that's an important part of choosing a compounding pharmacy is knowing that, we're on the case. We're chemists. We understand how all of this stuff goes together. Now, that another important point is that the chemistry side sometimes it makes a difference as to what excipients go into these particular products, not just for people that have MCAS or mast cell or things like that, but there are other components relative to putting these things together that keep them potent over time. So again, we're taking all of these things into consideration as we move through the process. Also, just something as simple as weighing stuff. I mean, some people try to produce kind of this stuff with their kitchen scales in at home. That's not a great idea. It's no match for my $50,000 four-place scale. It's just not, and I'm sorry, but trust us to do things like that because we've trained long and hard to do so, and it's basically for patient safety,
Right.
and that's part of what we provide. You
No.
know,
And also it's the flexible dosing, right? Because when you started making
it
methylene
is.
blue for me,
Yeah,
we generally get 50 or 100 milligram capsules. But I've also had patients that, need lower dosing, very
yep,
specific dosing. So one of the advantages of compounding is that you can get
yep,
much lower doses or doses you can't get from the regular pharmacist, right?
absolutely. The dosing's important, and sometimes the route of administration. I mean, I don't typically, offer this, but in some patients that have a G tube or a J tube, where, in other words, they're not putting it into their mouths. I have made solutions before. I don't normally recommend that because it stains the inside of your mouth and kind of makes you look like the crypt keeper. Nobody wants to do that. So, different applications are our specialty. We've even made topical, things relative to methylene blue for things like breast cancer and things like that. So there's lots of different ways to use it. It
Right.
is a remarkable drug. Yeah.
Right. So the methylene blue is one of the ones we order. The other one, I would
Yep.
say, I mean, we've gotten for years, and I take it myself. I still take low dose naltrexone LDN
Yep.
because of the effect on helping to decrease microglial activation in the brain. But you've
Yes.
also compounded everything from a half to 1 milligram up to
Yep.
4.5 and higher, right? So again, you do this very specific, right,
Yes.
dosing depending on what people's needs are, right?
Oh, it's very bespoke. It's for that particular patient, and that kind of flexibility allows practitioners to make all kinds of very good decisions relative to dosing, and it allows you to taper things up very gently if you want to, which is common in naltrexone. The other thing about naltrexone is just like the methylene blue, it matters what kind of excipients you put in there relative to the naltrexone, specifically for absorption. There are places that just randomly select excipients to mix with the naltrexone.
Mm-hmm.
That's not how we do this. It's very scientific. It's very chemistry based, and it's important because the doses are small. So you want to make sure that they get absorbed properly. And again, that's part of what we do.
And
Is
and
the
you also
dosing.
have the ability, I mean, you guys have a lot of liposomal formulations for the absorbability, right? So, regarding that, are you able to make most of these in liposomals? Some of them, you want to explain a little bit how you decide which ones you're doing in liposomal formulations or which ones you're not?
Well, here's the thing. Yeah. Now, liposomal is a big discussion. Liposomes, as dictated by the FDA, are very specific, specifically sized. In other words, you're taking typically an aqueous drug, and you're surrounding it with fat, essentially a lipid layer. What we tend to do is we make either nano or micro emulsions that are essentially liposomal, but we don't call them liposomes. We call them nano emulsions. And you can take all kinds of different oils for that. You can use grapeseed, you can use olive oil, you can use almond oil, which is a pretty popular one. And what you do is we have machines that can mix at a very high G rate. Like on a jet, it basically puts these things together and creates these. They're not liposomes, but they're a mix of the drug and the oil, and we
An
put those in
emulsion that's coming
an
together.
emulsion. It's an emulsion, and you go ahead and you put that in an acid-resistant capsule, and you have something that's very absorbable. Now, you don't need to do this for everything. This is in cases where someone may be super sensitive to it, and it gives them dyspepsia, or they have certain things in their alimentary tract where you kind of need to slow down the process so they can absorb the drug. The neat part is that we can do this for a lot of different things, and we do it for a lot of different things to help patients, get the dose and the absorbability, the bioavailability, we call it, that they need. Yeah, it's important.
Right.
Yeah.
No, that's an important point. So Randy, if people want to get in touch with you, I'm sure they're going to have questions. You want to remind them good email and phone number to get in touch with you and InfuServe.
Oh, a great phone number that has been around for years is 800-886-9222. And that is a very, very common number. It's something that a lot of practitioners remember because we've been doing this a long time. But the other thing that they could do is they could go ahead and email me at, it's very simple. It's Randy at infuserveamerica.com. And InfuServe it's like infusion and service put together. We've had it for so long. We didn't want to change it. We did still do a fair amount of IV stuff. That's the infusion part. So yeah, Randy at infuserveamerica.com. You can find it online. It's pretty easy.
Great.
Yeah.
No, thank you. So
Thank you.
yeah, so let's dive back in a little bit into again some of these compounded
Yeah.
formulations that I've used, and I know other other Lyme doctors have used. Can we talk a little bit about compounded pain creams? Because so many of our
Mm,
patients come in, they
yes.
come in with neuropathy, they come in with joint pain, their stomach just can't tolerate the anti-inflammatories. Talk a little
Yep.
bit about, how you're mixing things like putting things like, Elavil, amitriptyline, and gabapentin, and NSAIDs in like one compounded formula to avoid the
Yeah.
GI side effects.
Oh, we're that has been a success story from the beginning, and this is not new. We've been doing these kinds of pain creams for, I don't know, a decade or more. The neat part about them is that they work. That's the exciting part, and you're absolutely right. The other part is that, yeah, if you have somebody that has GI upset or other difficulties, applying this topically not only works, but it keeps the side effects down. Okay, and it makes it easier to kind of modify or applications or scheduling. You can move things around a lot easier than just taking it by mouth. And we get to use a lot of fairly exotic things. Yeah, baclofen, gabapentin. Sometimes we use lidocaine. There's all kinds of ketoprofen, all kinds of different things that really do help those particular areas. We've even put things together for certain neuralgias, like certain trigeminal neuralgias, things in the face, things in the neck. Very successful stuff. There is a fair amount of penetration for these particular drugs. Now, the creams that we create are very specific to, as far as the bases go, to help the penetration of these drugs. Sometimes we use things like DMSO. There's other different combinations of bases that really help the drugs themselves get through the skin and to where they're supposed to go. It's a fantastic thing. It's worked very well.
Right. So, and that's a key point, right? Because DMSO, in fact, is one of those compounds that allows the absorption to be
Oh,
better. So,
DMSO is a great one. Oh yeah, we love that one. It's a great drug.
so for some, because neuropathy is such a common one in the Lyme population. So, for example, if they can tolerate like Lyrica, pregabalin, or
Oh yeah,
Elavil, amitriptyline, or
yeah,
I'm worried about the drowsiness from it even at low doses. Do you find that
right.
if you put in small doses, for example, and mix a little bit of gabapentin, a little bit of
Yep.
amitriptyline, a little bit of pregabalin, you're able to mix these in pain creams where you can keep down the side effects, but still get it to the place in the body, right, where it needs to be by just putting the cream on that area.
Yeah, well, that's the exciting part because it's topical. You're reducing all of these side effects that you would typically kind of see with oral preparations, but you get all of the good stuff without a lot of the bad. And again, like I said, you're able to kind of control application and the application site. You're actually able to put it where it hurts, and this is a good thing.
Yeah.
It's very
By
helpful
the
to
way,
patients.
so Randy, if you happen to put this is a good, interesting question for me. So if you happen to put a little Elavil in there, amitriptyline, and I have
Yep.
to watch for QT interactions with drugs when I'm doing dapsone
Hmm.
because
Right.
Plaquenil, hydroxychloroquine, Zithromax, and
Yep.
Zofran,
So yep.
ondansetron, if they need it for nausea, interacts. How much, if
Right.
someone absolutely had to use a pain cream with a little bit of something like amitriptyline in it, is the absorption enough with that I still would have to pay attention to this, even if it's in very low dose?
No, not at all. The typical amitriptyline kind of percentage in a cream is somewhere around 2%. Okay, and that's about 20 milligrams per gram of topical cream. The thing is that by the time it gets through the skin, the dose is so small systemically that you're really not going to see those side effects.
Okay.
And that's backed up by us using it in actual people for years. We know this to be true. This is nothing new for us. We know how this affects people, and that applies to some of all the other things that are in there. Gabapentin, amitriptyline, baclofen, all kinds of different other drugs. You even get to use some of the NSAIDs. You can use ketoprofen. Okay, and because the dose is smaller, you don't get as much stomach effects as you would if you took it orally. So yeah, there's a lot of benefit to it. And
Yeah.
again, these are things that we've done in at this point thousands of patients.
Right. And with these creams, also you compound bioidentical hormones, right, for specifics, because I have
Oh, we
patients who've
do.
gotten them and
Yep.
or even thyroid dosing, right, where they need these
Yes.
kind of very small thyroid dosing where you can put the T3, T4 ratio, right? Very specific in these, right?
Yeah, yeah. The ratio is really interesting. I mean, people have been using armor thyroid and thyroid and things like that. Well, those come from bovine and porcine sources. Okay, and the ratio of T4 to T3 is not absolutely correct in those formulations because they come from animals. It's actually their ratio is 1 to 4.3. Well, a ratio in a normal human is supposed to be 1 to 3.3. Well, we can make that happen because the bioidentical T4, T3 that we use is doesn't come from porcine sources or bovine sources. It's synthetic essentially. And it's bioidentical, which means if I took T4 or T3 out of your body and looked at it chemically, it would look exactly the same as the stuff that's in the jar on my shelf. That's the nature of bioidentical. The other part is that, yeah, I can make all kinds of different doses. I can make sure that physiological ratio between T4 and T3 is correct, but we can also do all kinds of other interesting things. Thyroid is very dosed very tiny in very tiny amounts, microgram amounts, and so absorption can be a problem. Sometimes in certain cases, we actually make the capsules sustained release, which means they have a longer period of time to absorb the very small amount of drug. So oftentimes when we change people over, they're very happy. They say, "Oh, now I feel better." It's a thing. It's a very good thing about compounding.
Right.
Yeah.
One of the ones I get from you guys all the time, I mean, I'm using it in every Dapsone patient also, is peppermint oil. So why don't you talk a
Yes.
little bit about, because we had to decide when, I was going through the literature and I was looking up biofilm agents to figure out what was going to be the best ones to use with biocidin, cinnamon, clove, oregano oil, stevia.
Sure.
And I found this one in the literature about peppermint oil helping to lower like the MICs of gentamicin. So you didn't have to
Yeah.
use it for like Klebsiella. And that's how this got started. Tell people a
Yeah.
little bit about how you decided about the dosage, because you can't just like swallow peppermint oil and you put it in a compounding capsule also
Right.
with
Right.
a little
Yeah.
bit of glutathione. So how did you come up with the ability to do this?
Well, the glutathione is a great antioxidant. So what we were doing was we were using the glutathione in a very chemical way to make sure that it didn't oxidize, the oxygen didn't oxidize the oil. That happens a lot.
Mhm.
So that's part of the reason why we combine those. The other thing is that the capsules themselves, we can make them what they call acid resistant. So that kind of gets them through the stomach, which is a good thing because peppermint oil, if you've taken it orally, just like a teaspoonful or something like that, it kind of burns a little bit. So the idea is to kind of get it through the stomach into the duodenum and the other parts where it can get absorbed um, more easily. And without all of the other, you can get dyspepsia if you have too much of that particular oil at any given time. So we, put it in capsules that make it go through a little faster. And this is proven to be very, very effective. And we're right back to the sources of things. See, we can't just use peppermint oil that you buy off the internet. Our source has to be USP. So there's certain things that are important about that, not the least of which is that you get a certificate of analysis that tells you what's in it and what's not. So that's would you be able to see whatever impurities are there or not there. So you get a very pure form of the peppermint oil.
Yeah.
Is
And
the
you
thing.
know, you brought up an important point for Lyme patients regarding the stomach and the acid capsules, be able to get us through the stomach. A lot of patients, of course, they have stomach upset when they do these.
Yep.
I also know that, to try and get an extended release doxycycline sometimes from the pharmacist can cost an awful lot of money. And I know on
Yes.
occasion we've
Yeah.
called you guys and said, can you make me an extended release doxy or minnow, right?
Yep.
And that's been
Yep.
helpful for the GI tolerance. So you want to just talk a second about that because that's really been great for us also.
Yeah, well, I mean, you can help me here. The GI tolerance is part and parcel of the fact that Lyme disease patients have this, they'll they'll be allergic to things that they never were allergic to before, all of a sudden. So this would be, mast cell, MCAS, multiple chemical sensitivity kind of stuff. This has everything to do with how we prepare things. And yeah, you can go ahead and get a sustained release product of a certain antibiotic. But the other part of that, which is kind of cool, is that when typically make it dye free. Okay. And, you know, um, titanium dioxide free. We'd make it, yeah, in other words, all of the typical excipients that are used in commercial products, we don't use because we don't
Right.
have to.
And
We,
titanium dioxide really just got taken out a couple of years ago because I remember,
yep,
without mentioning where we were getting the source, but I used to get a liposomal glutathione. They were using it, and then the company
yeah,
contacted me and said, the
no,
data on titanium dioxide not so good anymore. What do you think about switching? I
yeah,
said absolutely. So
yeah, yeah. Things like magnesium stearate. That's another very commonly used thing in big pharma. We don't use things like that because we don't need to. And we've taken a lot of pains to make sure that the chemistry of the formulation works. We don't just add, random excipients. We do all kinds of different ones. I have patients that are so sensitive that we've actually used things like carrot flour as an excipient in the capsule, and that has worked in many different patients. We've used coconut flour. We've used all kinds of different things, and again, this is part and parcel of the importance of a compounding pharmacy. You get to pick and choose, which is
And
important.
this is important because the mast cell aspect, I mean, you and I, we know who some of these patients are who are
We do.
incredibly sensitive. The one patient you and I think are probably talking about, she'll have anaphylaxis going outside when they're mowing the grass, right?
Yep,
And this woman's mast cell is just off the wall the
off the
minute she gets
charts.
exposed. She's only been able to tolerate your compounded medications with coconut flour and carrot flour, right?
Right. This is true, and that's the other part about Lyme disease patients and writ large is there's a certain it's the immunology is very complex, and for whatever reason they can be fine with one thing 1 minute, and then a couple weeks later they're allergic to whatever it is. I mean, I just talked with a patient yesterday who can only eat one type of food. Her MCAS is so bad,
Mhm.
her mast cell is so bad.
Yeah.
So yeah, these are we become the only option at that point for medication
Right. And
a
you
lot
and
of
you guys have
times.
been compounding ketotifen for quite a while for us for the mast cell. Are there
We
any other
have,
what
yeah.
what other things are you doing for the mast cell that maybe even I don't know about? Is there any other products apart from ketotifen you guys are doing?
Yeah, we've been using the ketotifen almost exclusively. The neat part is that ketotifen is only commercially available in the United States as an eye drop. They've been using it in Europe over the counter you know, for years, but the only way to do it orally is to have it compounded. And again, you're it 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 has some very interesting properties relative to mast cell, and we've been doing a lot of work with that. I mean, at this point, like I said, thousands of patients on ketotifen. We have been. It's not something we do a lot of because there's certain things having to do with the commercial product, but we still use cromolyn. Not all the time, but we still use some of that. Um, there there are a few other things, but the ketotifen tends to be the mainstay.
Right.
The other thing, writ large is that we know that they have these difficulties, so we can make things that don't have the items that they're allergic to or
Mhm.
have problems with.
No, no. Also, years ago, I don't have to do IV therapy so much anymore ever since I discovered
Sure,
Dapsone. But years ago, I remember when I could not get the insurance company to approve IV ceftriaxone Rocephin, I would
sure.
call you up and go, "What is your cash price for it?" And I was amazed that it was like a tenth of the price of what the insurance companies wanted to charge some of these patients.
Yes.
Are you still compounding and getting people things like some of the IV drugs that maybe their insurance company is not covering?
Oh, sure. Yeah, we're still doing IV drugs. Have done that kind of thing for years. Yes, we're trying to keep the prices as low as possible. Again, like at the beginning of our conversation, our focus has always been the patient, and we understand Lyme disease and Lyme disease patients and the fact that insurance doesn't cover a whole lot of things, or they don't want to, or the testing isn't right, or there's a lot of different reasons. The interesting part is that not only have we tried to keep the price low, but we manufacture things or make things in a way that are patient friendly, because you're usually doing this in the home, and a lot of times patients are doing this kind of not on their own, but they're kind of self-administering things,
Right.
and we
They
make that
usually
as
have a nurse or a
easy.
healthcare, somebody who's
They
kind of
usually have a
overseeing,
nurse,
but
yeah,
yes, they
to
end
kind
up
of
doing it
help
on
them.
their
But a
own.
lot of times there's different products like home balls and different types of IV tubing that we've used over decades that help people do these kinds of things in the home. A lot of time, a layperson would think IV is fairly complicated, and it is, but we can make it less complicated, I guess, because we've done this for so long. We
So,
have some of the
I
answers.
forgot, this is a good thing you brought up. Talk a little bit about, because I remember I used to get these years ago, the patients who are worried about hanging these drips from the poles and the rate.
Right,
Talk
right.
about these
Yeah,
balls
yeah,
that you're actually using to be able to give them a constant flow. I think this is
yeah.
fascinating. I think people
Oh,
should know it's available.
oh, they're really interesting. Yeah, yeah. I mean, they come in different sizes, and they call them elastomerics because they're elastic. And what we do in the clean room is we fill these. They start really skinny, okay, and then when we fill them with the diluent and the drug itself until you get about a baseball or softball sized home ball. And then there's a little piece of tubing that comes off of this thing, and the fact that they're elastomeric, they can work upside down, right side up. It doesn't matter. You can put them in your pocket. You don't even have to hang them off of an IV pole. And it's just like a balloon. It creates pressure. And everyone goes, well, how does it know how long that this goes for? Well, it's all physics. It's the length and the diameter of the tubing itself that controls how fast the diluent runs into your IV line. And like I said, they're fascinating, and they're compared to an IV pole, they are incredibly convenient. You're flushing your line like you normally would. You hook them up, and there's no button. You just flip open the catch, and it runs, and it's done. It's like a set it and forget it. And then
Right.
when it is done, you clamp it off, flush your line, and you're done.
Right.
You know.
And I think the beauty is when people are using, they have to do home infusions and they usually have a home nurse who taught them to do it. You guys are always available. Like if people have questions
Oh,
about
we are.
sterility,
Yeah.
administration, side effects,
Yeah.
they can call you up at any point in time as an extra person, right, to make sure that they're doing this properly.
Yeah, that's the interesting part is that we're always available during working hours, but we also have a pharmacist on call after hours. If you call the 1-800 number, and push zero, like you're trying to get to the operator, count to 10 slowly, because what it's looking for is the pharmacist on call's phone. That's what they're looking for, and that's available 24/7. And that is kind of useful not only for IVs, but for some of the other stuff too, because some people, they have questions about their compounded medication. It's not as obvious as some of the other things, and we like to be there to answer those questions, because it's important to how they take it, the dosing, administration routes, all of that stuff. Because we do others, not just IVs, but injectables too, methylcobalamin and other things that are given subcutaneously or intramuscularly. So it's important to have somebody on staff that knows about those types of things. We
Right.
even do bladder instills, so that's another thing
Right. And we've
that we
used
explain.
both for the people that have methylation issues, we've actually compounded hydroxycobalamin, right,
We
versus
have.
methyl from you guys. And
Yep.
that's true. That's an excellent compounding medication
Yeah,
for those people who just can't take a methyl B12, right?
exactly. Yeah, and there's all kinds of reasons to do it. There's methylation issues, and then different types of B12 are also good for peripheral neuropathies. So, and which is, you've used that for years successfully.
Hmm.
So,
And if
yeah.
I'm remembering correctly, even years ago when I couldn't get Bicillin, I don't use it anymore with benzathine penicillin, but I think also we were even I can't remember if we were even getting it from you years ago because we couldn't get it from regular sourcing. You guys have it available in case people need it?
Oh yeah, yeah. It did. Benzathine Bicell in LA went out of print for a while, but yeah, we do have access to that. Um, um, when it went completely out of print, this is what happened. We actually see intravenous penicillin GK can be used intramuscularly. It just has a very, very short half-life. Well, we took a page out of the World War II handbook, and we gave these intramuscular injections of regular penicillin, but to keep it in their body, we used another drug, oral drug called probenecid. And what it does is it keeps the penicillin from running out your kidneys and out through your urine. So it keeps the drug levels high. So we were able to use an intravenous medication intramuscularly along with an oral preparation to keep the levels the way they were supposed to be.
Yeah, that's
Yeah,
great.
that's when it wasn't available at all. So yeah, yeah.
Right.
So
So Randy, we've been discussing, and I'm just thinking if there's other we went through the sub-Q because you're right, methyl and hydroxycobalamin we use all the
yep,
time.
all the time. Mm-hmm.
We talked about using compounded peppermint oil and methylene blue, which we use for dapsone all the time, right?
Yep.
Low dose naltrexone, which I'm using in most of my patients, the compounded pain creams, compounded medications for people with chemical sensitivity, mast cell with the
Yeah.
coconut, carrot flower, hormones. What else do you think, ketotifen? Are there any other like classes of things that you guys are doing that people may not be aware of or they have access? Because I think those are probably the most common ones we have used Infuser for.
Yeah. The one that we nearly touched on a couple of moments ago was the bioidentical hormone replacement, or the BHRT. That is something that we've been doing for so long that some of the other pharmacists and I we actually teach other practitioners how to do that. We have different classes for that so that they can understand exactly how to write a prescription for something like that. And that's a whole beautiful kind of area that involves not just the hormones themselves, but it also involves the thyroid, which we talked about, and also some of the adrenal gland stuff. So there's three portions to bioidentical hormone replacement. It's not just the hormones; it's also your thyroid and it's also your adrenal glands. You have to take all of that into account.
Right.
And
So for
yeah,
practitioners, for
yeah,
example, that want to use bioidentical, that let's say their local
yes,
OBGYN doesn't want to do it, if
yeah,
they need to use E3 vaginal suppositories, a
yep,
milligram, putting
yep,
capsules, you can compound those for women in menopause, right? That maybe don't want to do
absolutely,
estradiol, but
yep,
you'll actually teach the doctors the right
yep,
amounts. Like you'll get the body weight from the woman. You'll say,
oh
listen,
yeah,
based on the hormone testing, this is the amount of estradiol.
yep,
I can use less, more
yep,
progesterone. So you will adjust it based on the blood tests. The doctor, in a sense,
yep.
doesn't really have to worry. They just have to send you the blood tests, right? And you'll
Yes,
help
yeah,
do
yeah.
it with the follow-ups with the
Yeah, we
practitioner.
do all the recommendations for that. Yeah, if they go ahead and send us some lab work, and sometimes we go ahead and kind of talk to the patient a little bit to find out what they're currently using, and then create a recommendation for that. Involving all the three things that I talked about, because again, you have to take all of those things into consideration. The thyroid stuff can sometimes be a little flummoxing. Go ahead and you can send us those labs. We can suggest the types of labs that you're going to need, because typically when somebody does thyroid, they do T4, T3, and then some TSH. There's a couple of other things that are important about the laboratory work for that, like reverse T3 or total and free T4 and T3, because there's like 5 different places where thyroid can go wrong. And if you don't have the full set of labs, you can't really pinpoint where that occurs. So that's something we do a lot of. A lot of times you can, like I said, send us the labs and we can send you a recommendation for all of those things. And
That to
and it
have
works.
someone kind of, even if you've gone through the training, which I have, at
Right.
these integrative
Right.
conferences, to have a
Yep.
pharmacist hold your hand during the process and do it with you,
Yeah.
I think it's a great bonus along the way because I think people have a lot more confidence, right, in prescribing that way.
Oh, definitely. Yeah, there's I know some of those instructors that the A4M and the other. There's nothing wrong with the didactic portion of those. Those are great classes. You should do those. The problem often is that when you get down to the nitty gritty, the nuts and bolts of it, and you've got a laboratory result and a patient, and you have to write the prescription. Sometimes that's where we can help the most. Is route of administration, dosing, what to use, what not to use. There's a lot of different things that go in with that. So let us be your guide. We've been doing it a long time.
Right. Yeah,
Yeah.
the E3 1 milligram suppositories, vaginal suppositories is the one
Yep.
I probably the most common. I used to
Those
do
are
more
great.
bioidentical years ago. I left the GYNs, but you
Yeah.
reminded me actually now. This is actually why this is a great conversation. It's even reminding me that, oh yeah, that's right. You guys actually do that. And I forgot
Yeah.
you did this for us. In fact, many times over the years. It's
Absolutely.
actually a
Yeah.
great reminder.
Yeah, we love stuff like that. It allows us to get even more into some of the patient profile kind of stuff, and sometimes, not all the time, sometimes we see other options or other opportunities while we're looking at BHRT because there's so many systems involved. Sometimes you notice other things, and there's other things that can be done. I just had something like that happen to me just yesterday. I was doing a profile just like that, and I noticed that the patient was on two of the basically the same thing. It was therapeutic duplication. So today I'm going to be calling the practitioner and kind of letting them know what that dosing probably should be, and some other options that we can do for the patient that are probably more beneficial. And
Mhm.
that's again, that was just a happy circumstance. I was doing what we were doing, and I found something that was important. It doesn't
That's right.
always happen, but it's a good thing. It's
Yeah.
a second pair of eyes. Yeah.
Yeah. No, Randy, this has been fabulous. So, are there any subjects you think for the compounding we haven't covered? Because I think I've gone over most of the ones that we use in future
Yeah,
all the time.
we've gone over most of the things that are truly important. The only other thing that I could possibly mention is that over the last probably 12 years or so, a decade or plus, we've done a lot of work in the area of interstitial cystitis. This is a classic kind of you know, um, fungal bacterial infection that nobody can quite nail down. A
The
lot of these
Lyme Bark
patients,
patients complain of it all the time.
right? And what we've done is we've kind of utilized or leveraged some of the DNA PCR technology for lab work to see what those organisms are in the bladder. And we've been able to go ahead and choose really effective antibiotics for those particular for that lab work. And to treat those organisms, both fungal and bacterial. And we do it through, we get to use some pretty exotic antibiotics because you do it as a bladder instill from the outside, which means you get to use things like vancomycin and aminoglycosides and all the other stuff that's very effective, but you don't get all the other side effects because it never gets into the systemic circulation.
Mhm.
So you get to treat something that has been untreatable for 10 to 20 years with some pretty exotic things. And
But
yeah,
these would be people who I would be self-catheterizing to be able to do
right,
the
there'd be
installation.
self-cathing. Yeah, that's the other thing that we've kind of taken the mystery out of that. Some people, typically did that not a hospital setting, but yeah, hospital settings, but a practitioner setting. I've had anywhere from 20-year-olds to 90-year-olds self-cath themselves. A lot of times, for the most part, we use 8 French pediatric catheters for this. They are incredibly tiny. You don't really need a big adult catheter for this. And this
Well, I
helps
can't tell you
reduce,
how happy that makes me because the
right?
the idea of bladder installations is using anything
Yeah,
more than an 8 French. It's kind of like what Marquis de Sade doctor who loves to
right,
torture people came up with this idea.
right. And the other thing, I mean, part of the reason is that a lot of these patients already had physical impediments, already had damage to their urethra. And so the smaller catheters work fine. There's no reason not to. You don't need an adult catheter, 10 French to do this kind of thing. And when I talk to them about it, it's like when you have the catheter in your hand, you'll understand what I mean. Because when you have an 8 French in your hand, you're going, oh, this is tiny. This is really tiny, but it's effective because I'm only putting in about an ounce of fluid at a time.
Mhm.
Okay, and into the person's bladder. The other interesting part is we get to use some EDTA in there, typically, as long as the antibiotic can live with it. The EDTA breaks down the biofilms so that the antibiotic can do its job, and that's another huge advantage to things like this.
It's interesting you bring that up because I just spoke to somebody the day before. In the dapsone protocol, even though I'm not using it all the time, in some of
Yeah,
the highly resistant patients, I've talked about the week that they do the dapsone pulse for when they finish the 9-week oral double dose with one
yeah,
pulse, and they do these. I've actually told them to use EDTA suppositories in this case to be able to
yep,
break out the biofilms, apart from
yep,
using biocidin, cinnamon, clove oregano oil, stevia,
yep,
peppermint oil, which you're compounding. So
yep,
that it's a great reminder because
yep.
we have been using some of that, not just for chelation when lead is high, but also for biofilms.
Yeah, the other important aspect of treatment has been the use of intraurethral gels. These were these were in response for the longest time we thought there were reservoirs of bacteria or fungus, and we weren't quite sure where those were. Were they inside the bladder? Well, come to find out, it's some of the cells in and around the urethra were kind of internalizing some of that bacteria, and it's a hard area to treat. So what we did is we took some of the same antibiotics that we were using in the bladder and we put it into a gel that's very sticky. And yeah, a 1 cc syringe with about a half gram of gel in it, intraurethral, it spills out the edges. If you do this twice a day, you have basically a topical application of the same antibiotics. And it's not for all patients, but for those that are fairly urethral specific, it has been a huge improvement.
Yeah.
Huge improvement.
No, Randy, this is when we're almost coming on an hour of our talk. Boy, that went quick.
Wow.
I have to tell you, this has been, I think, this is going to be probably one of the most useful conversations people have during the Healing from Lyme Summit because I couldn't do what I do without compounding medications. We've been using you, I mean, for decades at this point.
Yeah.
I can't say enough good things about InfuServe and you and all the staff that works there, because what we've loved about you is not that simply, your pricing is low and you're always available and you're always helpful and compassionate, but that you are there all the time to help solve kind of medical problems when
Well,
we have
thank you.
difficulties with it.
Yeah.
So, I mean, I think,
Yeah.
having that kind of hand holding and support for what we do as Lyme doctors, to have a compounder like you has been essential. So I want to thank you and the whole staff at InfuServe, because I think people are going to have a much better idea after this talk why use a compounder, when to use them,
Right.
and
Yeah.
even for
Yeah.
doctors that they may not have known that you're available even for consultations to help with figuring out some of these medical problems that otherwise they can't figure out.
Yeah. Thank you for that. Because yeah. And you and I have been friends for decades at this point. But thank you for that. I really do appreciate it. Yeah. We're kind of in our prime for that. This is the benefit of years and years of doing things like this,
Yeah,
and we're in a great position to provide that kind of problem solving, if you will. And it's again, it's a tool in your toolbox. It's not something you use all the time, but when things get tough or things get a little weird, sometimes a call to us can at least put you in the right direction. Yeah.
that's great. So
Yeah.
Randy, just remind people one more time, phone number, best email to contact you if they have questions.
Sure. The phone number is real easy. It's 800-886-9222. And then the email for right now would be Randy, my name, RANDY, at infuserveamerica.com. Yep.
Great. So Randy, I
So,
want to thank you so much for taking the time to do this today. And for
oh,
those of
my
you who've been
pleasure.
listening, my name is Dr. Richard Horowitz. I'm co-host for the Healing from Lyme Summit with Mariah Hinch. And we are having just a fabulous summit. This is one more of the great talks you're listening to during this Healing from Lyme Summit. I hope all of you are enjoying it. And I look forward to seeing you again all soon. If you have any questions, again, you know the information now to contact Randy if you need any compounding solutions. So thank you again, Randy. It's been a great pleasure speaking to you. Please give my best to everyone at InfuServe.
I will. Thanks, Doc. Have a great day.
You too.